From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. Whether you're looking to fine-tune a few teeth or take on a full smile transformation, there's never been more options to straighten your smile. Two of the most common choices, traditional braces and clear aligners. Today, I'm joined by Dr. Bobbi Peterson, orthodontist, founder of Aces Braces in Brooklyn, and creator of the Big Mouth Toothbrush. Dr. Bobbi is here to help us break down the pros, cons, and everyday realities of both clear aligners and braces. Dr. Bobbi, welcome to the Care Experts podcast. We're so thrilled to have you here today.
I'm excited to be here, Erin. I've been waiting to meet you.
What would be the key difference between braces versus clear aligners?
Okay, so there's a ton of differences. Metal braces or clear braces or just braces in general, they provide a continuous force. Mm-hmm. So you see your orthodontist every 4 weeks and they do your tightenings. With clear aligners, every time you switch your trays, it's the equivalent of a tightening. So okay, they're similar, but it's very case sensitive.
So braces are providing continual force. You cannot take them off once they are cemented on. Mm-hmm. You have them on for the duration of the treatment. Mm-hmm. But clear aligners, you can put them in or take them out.
Yes.
And you, as a result, have to be much more on top of
yes, you absolutely have to.
Your treatment plan.
Yes. So in terms of treatment, when it comes to clear aligners versus braces, clear aligners pretty much, this is what I like to say to my patients. It's like 40% of your treatment outcome is dependent on you and 60% is dependent on us.
Okay.
With braces, since it's continuous, I would say I would make that percentage a little bit less, but you just have more inpatient appointments. So you have to come to see your orthodontist a lot more when you have braces as opposed to clear aligners.
So if you're somebody who is conscious of not wanting your teeth to look like they have braces on it, a clear aligner would be a better option than doing braces at the back of your teeth?
In my opinion, yes. It's much more comfortable, but the drawback with clear aligners is you've got to be accountable for your trays. Mm-hmm. Like you have to. And I understand that with a lot of patients or people that have a very busy life, if you're not accustomed to having, something in your mouth all the time, it's hard. But I feel like if you can make that commitment, then it's much better for my adult patients to do clear aligners than it is to do braces. Okay.
And the process of getting the clear aligners versus braces, what does that look like as far as that initial appointment that you're going to when they're putting on the braces or putting on your attachments?
True. Yeah. So I'll walk you through the process in my practice. So we do a consultation. Someone chooses clear aligners. We're like, okay, we're going to do a scan, a iTero scan. Most of your viewers are probably familiar with that. We don't take impressions anymore. We rarely do those anymore. So we do the scans and we submit it to whichever clear aligner company there is. It takes about maybe 2 weeks for it to come back.
Okay.
And they give us a series of trays. The first visit, when you come back after that, we apply the attachments. And we give you normally, depending on the case, but normally we'll give you 2 or 3 trays and we'll tell you you're going to wear them every 2 to 3 weeks. And then bye, we'll see you. Bye, we'll see you in 8 weeks or whatever.
Yes.
With braces, it's a little bit different. And a lot of my braces patients are a lot younger. Mm-hmm. So we have to take much more time and much more care into explaining to them what the aftercare is. So we do the consultation and the parent is always in the room because we need the parents to know exactly what the patient's supposed to eat and not eat, how, the home care instructions is very important. So in my practice, we like to express and explain in detail what the aftercare instructions are with the patient at the consultation and when we place the braces. So once we place the braces, my staff speaks to the patient. So a one of the biggest differences between braces is how you have to take care of the braces while they're on your teeth, because you can imagine these are pieces of metal and there's a wire. So everything you eat is going to get stuck to your teeth. So we give them a kit to keep their teeth clean, but they have to be seen every 4 weeks.
And that's so that you can adjust the wire that is going to tighten those brackets and ultimately move the teeth into the correct position.
Yep.
When you're applying braces and the little metal pieces to the teeth, are you putting them in specific positions that are going to pull them? Like, how do you know where you're gluing them to the teeth?
Yeah, there's a lot of training that's involved between me and my staff in terms of where the brackets are placed on each tooth. Each tooth has a different anatomy. So when we place the brackets, they're placed in different positions. Also, depending on the size and the position of the tooth. So without getting into like further detail, your orthodontist, whoever your orthodontist is, they have been trained to position teeth on certain size teeth and then certain positions in order to move those teeth in certain ways. So just for giggles, if someone there are a lot of oral habits that are in place. So say someone they suck their thumb.
Yes.
Right? There's a lot of people that suck their thumb or have some sort of oral habits where their bite is open. So I'm sure a lot of your viewers have seen people who, when they bite down, their anterior teeth are still open. When we place brackets, we want to close the bite. So there's a certain position that we will place the brackets in order to close the bite down. But if that habit is not stopped, or if that person's not ready to stop the habit, we can make their teeth look beautiful. But a few months after, if they're still, then it's going to open right back up. So that's why I say to my patients all the time that retention is the most important part of your treatment.
We're going to talk about aftercare and retention.
Okay.
As far as aftercare, once you have your clear aligners, what does that look like while you're still in the treatment process?
So what I tell my patients is every day when you brush your teeth 2 to 3 times a day, you take them out, you brush them, you put them back in. You just use your regular toothbrush, place them back in. Every 2 or 3 days, we have these crystals that you can put into a jar with water, and there's, directions, and you can soak them. But I try to let them, I'm like, listen, be mindful that regardless of what you're doing, you're supposed to be moving through these trays consistently every 2 to 3 weeks. So yes, keep them clean, brush them, put them back in. Similar to the aftercare for when you get your teeth whitened. They're like, make sure that you are not putting anything in your mouth that could stain a white shirt. And I want to be very transparent when I say that. We're talking about red wine. We're talking about curry. We're talking about smoking. We're talking about coffee. We're talking about tea. Like anything that if you're wearing a white shirt will stain it.
So are you saying, though, that if I have my clear aligners in and I want to have a glass of red wine or curry, can I take those aligners out and then enjoy that, brush my teeth really well, and put the clear aligners in, but you just would never have a glass of red wine with your clear aligners in?
Correct. That is exactly what I'm saying.
Gotcha.
That's exactly what I'm saying.
Now, with braces, are you still able to floss fully with braces? What does the care look like while the braces are in?
So in terms of cleaning between your teeth, we give you a kit, and there's something called floss threaders that allows you to floss around the wire and clean. Yeah, and my staff will show you how to do it. We also have YouTube videos that, will show you how to floss between your teeth. But there's a very different way to floss. Hence why a lot of these teenagers don't do it.
Which brings us to the fact it doesn't happen.
It does not happen.
How has technology changed in the area of orthodontics? I've heard about the option for accelerated aligners. Who would this be right for, and what does that even mean?
So accelerated aligners work for minor cases.
Okay.
So minor cases and people with very solid bone.
Mm-hmm.
So a lot of things that have to do with like orthodontic treatment times and how it works and like, you know, whether or not we can treat someone that's like 70 is based off of your bone age, not your chronological age. So people always ask me like, how old was your oldest patient? My oldest patient was like 65. So it's not about the chronological age.
Yes.
It's about the bone age. And that 65-year-old woman, she got actual braces and she was,
Really?
yes. And she was wearing all the colors and all that. Cause it's, but then I could get like, I would probably receive like a 35-year-old that has periodontal disease and they cannot get braces, you know? So there's that shift, you know?
Right.
That's where it comes into play. What comes into play is the professional really like doing a deep dive into who's a candidate for what.
Right.
Are you a candidate for braces? Are you a candidate for clear aligners? Are you just not a candidate at all? Because when we do clear aligners or braces, we apply a lot of force and a lot of pressure. So if we're applying that pressure and you have minimal bone structure that holds your teeth into place, you're not a candidate.
Right. As an orthodontist, you have done years of school. How many years would you say that you've done?
Yes. So I did 4 years of undergrad, 4 years of dental school, and then 2 years of a general residency, and then 3 years of an orthodontic residency. So that's a lot of things. So that's something that a lot of people don't know. So when they come into my office, some people think that there isn't more schooling that you have to go through to be an orthodontist. Orthodontics and oral surgery are the most specialized dental professional specialties.
Right. Yes.
They are the most competitive. Like when I tell you that I'm still like I went to Maimonides for my orthodontic training and it was 3 years and I'm still the only, you know, Black person that's ever finished that.
Wow.
That residency. It's nuts. Like and they only accept 2 per year.
Wow.
So it's very specialized and I rarely ever say that.
You should say that more.
I know.
People
I'm
need
surprised
to
I'm saying
know
that.
this. Yes, it's amazing though.
And it's orthodontic specialties and oral surgery specialty. The specialty in dentistry is just it's super specialized. So yeah.
So you want to be going to somebody who has done this massive amount of education, is using research-based tools and innovations
100%.
in order to get the results that you want and to do it safely and in a way that's going to last.
Yep, and preserve your bone and your face.
Let's talk a little bit about that preservation piece quickly.
Yes.
When you finish your clear aligners or your braces, what's the main difference between those two as far as the aftercare?
So when you complete your orthodontic treatment period, whether it's with braces or clear aligners, what I tell my patients is for the first month to 2 months, you wear those retainers every day, all day. Okay. Then after that, it's so funny because my patients are like, okay, do I still need to, after that, they're like, do I still need to wear my retainers? Yes. It is our job to tell you that you have got to have a retainer in your possession for the rest of your life. Because no matter when you get your orthodontic treatment or when you receive it and finish it, your teeth are always going to want to revert back to where they were when they started. They always are, especially if you start and complete orthodontic treatment as an adult. That's when it's even more imperative because you're not growing anymore. You're not in the growing stages of your life anymore. So you start that, your teeth are very settled. They're very, very settled into where they are. And then you move them. So it's like, all right, well, we're moved, but we're going to want to move back.
There's still some space.
There's
It's
still
not
some
like
space.
the bone
There's
is
still-
still growing around this newly placed tooth.
Yeah. So my job is to tell them that you need to wear your retainer every day for life.
Okay. I have some amazing questions from our audience for you.
Uh-oh.
The first one, I grind my teeth at night and have to wear a night guard. Can I still use clear aligners?
That's actually a really good question. I've had patients that are bruxers. It literally depends on the extent of your bruxism. Bruxism is grinding.
Yes.
So it depends on the extent of your bruxism. I would say about 95% of my patients, once they get the clear aligners in, they're good. They can clench as much as they want, but they're good because most mouth guards are on one arch. When I say arch, I mean either upper or lower.
Okay.
Clear aligners are on top and bottom. They may not be as thick as a night guard, but the combination between the two is so that when you clench, you're all good.
You're protecting your teeth
You're
still.
protecting your teeth, yes.
And it's not going to break the clear aligners
I've never seen it break clear aligners. And you also have to think, you're changing them every 2 weeks.
Right.
So you might, even if we get like maybe a little bit of grinding, you're changing it. So it definitely helps.
My son plays football, and I'm considering clear aligners over traditional braces. Any recommendation on which would be better for playing contact sports? I'm worried that traditional braces could cause injury.
I don't know what age that patient is, but I do have a lot of patients from 7 all the way to like 18 that play sports. And what I do is I get them customized mouth guards.
Okay.
Yeah,
that they
that's
put
what I
over
do.
the braces.
Absolutely. I think it's so important. I mean, just protection with any sport in general is imperative. And we want these kids to keep their teeth forever. We want everybody to keep their teeth forever, right?
Yes.
So, we give them customized mouth guards because when kids are in transition with their teeth, it's best to have it customized, and it'll form fit their teeth at that time and protect them to the utmost. And that's what I'm focused on.
Perfect.
Absolutely.
So you're still deciding with a child that's an athlete, you're still deciding whether to do braces or clear aligners based on where they're at as far as losing their teeth and what's going to fit their personality the best. And if braces is going to be the best fit, then you just want to make sure you have the guard.
100%. Because with clear aligners, they can just remove them for the games. And there's no harm, no foul.
Yeah.
But with braces, since it's metal and it's literally situated right on the inside of your actual lip, there's a lot of injuries that could happen if the teeth are not protected. So that's why I give that to my patients.
Amazing.
Yeah.
If somebody's tuned in right now and they are trying to decide braces, clear aligners, what is the very first step in making that decision and getting more information?
I would say the very first decision is like, what is your lifestyle? What is your lifestyle? Are you the type of person that has a lifestyle where you're able to keep track of these aligners? Because most people, when they're eating, they wrap it in tissue, goes in the garbage. That's going to prolong. Did it happen to you? It's going to prolong your treatment time.
But I can only imagine. It's so frustrating for everyone involved. And,
it is. Yeah. It's literally like, what is your lifestyle? And what are your issues that we have to take that into consideration? I do feel that the majority of the cases that I treat can be treated with either one.
Right.
I feel like most orthodontists are skilled enough to align teeth and give great treatment outcomes. And it's literally based on the patient, when you're going to choose clear aligners, think about it as a 50-50. It's 50% you, 50% me in order to get to the finish line, okay? That's basically what it is. With braces, it's like 70% me, 30% you to get to the finish line,
Yes.
So that's basically how I would describe it.
Amazing. So helpful. Thank you so much for being here today. It was a pleasure to chat with you.
Pleasure was all mine, Erin. Thank you.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.